Anatomic sites and subsites for lip and oral cavity.
Mucosal lip. The mucosal lip begins at the junction of the mammalian border with the skin and includes only the mammalian surface, that portion of the lip that comes in contact with the opposing lip. It is well defined into an upper and lower lip joint at the commissures of the mouth. For staging purposes, tumors of the dry mammalian lip and commissure are now grouped with cutaneous sites, given their shared pathogenesis and similar embryologic origin of these subsites to skin. Only mucosal sites are covered by this protocol. Buccal mucosa. This includes all the membrane lining of the inner surface of the cheeks and lips, from the line of contact of the opposing lips to the line of attachment of mucosa of the alveolar ridge and pterygomandibular raphe. Lower alveolar ridge. This refers to the mucosa overlying the alveolar process of the mandible, which extends from the line of attachment of mucosa in the buccal gutter to the line of free mucosa of the floor of the mouth. Posteriorly, it extends to the ascending ramus of the mandible. Upper alveolar ridge. This refers to the mucosa overlying the alveolar process of the maxilla, which extends from the line of attachment of mucosa in the upper gingival buccal gutter to the junction of the hard palate. Its posterior margin is the upper end of the pterygopalatine arch. Retromolar gingiva, also called retromolar trigone. This is the attached mucosa overlying the ascending ramus of the mandible, from the level of the posterior surface of the last molar tooth, and the apex superiorly, adjacent to the tuberosity of the maxilla. Floor of the mouth. This is a semilunar space over the mylohyoid and hypoglossus muscles, extending from the inner surface of the lower alveolar ridge to the undersurface of the tongue. Its posterior boundary is the base of the anterior pillar of the tonsil. It is divided into two sides of the submaxillary and sublingual salivary glands. Hard palate. This is the semilunar area between the upper alveolar ridge and the mucous membrane covering the palatine process of the maxillary palatine bones. It extends from the inner surface of the superior alveolar ridge to the posterior edge of the palatine bone. Anterior 2/3 of the tongue. This is the freely mobile portion of the tongue that extends anteriorly from the line of circumvallate papillae to the undersurface of the tongue at the junction of the floor of the mouth. It is composed of 4 areas: the tip, the lateral borders, the dorsum, and the undersurface. The undersurface of the tongue is considered a separate category by the WHO. Thank you.